Hello, Dr. Pamela Douglas. Thank you so much for taking the time to meet with me today and to discuss babies and sleep.
It's my pleasure.
Thank you.
It's wonderful having you visit us here in Queensland on a hot summer's day.
It's wonderful to be here and thank you so much. I'm very, very grateful. I wanted to ask you, why did you end up studying babies and sleep and breastfeeding in the first place?
Well, you know, I'm a GP.
Yes.
From 1987, I've been in generalist practice here in Australia, and with a special interest all along, really, in the care of mothers and babies, parents and babies. Mm-hmm. And from 1994, actually, I'd qualified as an international board certified lactation consultant and practice breastfeeding medicine. So although I was doing generalist practice for years, I had a special interest in the care of mothers and babies, and I saw so much distress. And here in Brisbane, from the late 80s, I also watched how a particular diagnosis of gastroesophageal reflux disease began as an explanatory model, actually, for a lot of the distress that our babies and parents and babies were experiencing. So this is the beginning of the reflux diagnosis over use, if you like, in babies. It started here in Brisbane with particular paediatric gastroenterologist and then spread throughout Australia, and then I watched it become an international phenomenon. So I had this very close-up lens, if you like, as a doctor who also had qualifications in lactation support, watching a whole trend of what I could see was inappropriate diagnosis of distress between mothers and babies. So that really was when I began to research, because I wanted to understand what was going on and wanted to be able to put together different ways of making sense of the kinds of problems that were causing so much distress for families on the ground. At the same time, of course, there was this powerful trend within the English-speaking world, and it did, I believe, start in the English-speaking world, to apply what we would call first-wave behavioural responses to parent-infant sleep challenges. So from the 1950s, 1960s, we had the work of Pavlov and Skinner, first-wave behaviouralists, really become prominent in the care of parents and babies, and so that was a sort of phenomenon that I was also dealing with as I saw families with babies and toddlers in the clinic, and became quite passionate about really finding a different way of making sense of what was going on so that we could bring more joy into life in those first months, that first vital year or so.
So it's fair to say you've been in this field for many, many years.
I think that's true to say.
Yeah, it's true to say. Yeah, because my next question would have been how long,
wasn't it?
Yeah, thank you. But it's fair to say that you've been in this field of research quite a long time.
That's right. So I began to research in the late 90s and began to present at conferences in the early 2000s. I think my first presentation on what we would now call neuroprotective developmental care, but an early version of this was at a lactation consultants national conference in 2000. And my first formal publication actually in the medical research literature was in 2005. Okay. And over the subsequent 17 years, with various teams, I've built up the evidence-based neuroprotective developmental care, which parents know as the Possums programs. And so there's about 30 peer-reviewed and published articles out there now.
This is the fact that I love about the Possums program, that it's really truly so strongly evidence-based.
Yes.
It's the only one out there.
Yes, when we're looking at infant sleep and a non-first wave behavioural approach, my work really was the original internationally, and in fact other approaches subsequently in this space are really derivative of what we're doing with the Possums baby and toddler sleep program, cherry-picking evidence in a way that's not actually brought together necessarily as coherently as with the same integrity as the Possums baby and toddler sleep program, and certainly they're not evaluated. So the cherry picking of evidence, whether it's from my own work or elsewhere, is not actually the development of a genuine evidence base to, say, infant sleep. And of course, in the NDC programs more broadly, we're looking at a multi-domain approach to the care of that mother and baby, those parents and their babies, knowing how sleep actually interacts with breastfeeding feeds, with an infant's sensory motor needs, obviously with the baby's health, baby's gut, what's going on there, and then with parent mood, with maternal mood.
You're looking at the bigger picture.
So we have a 5-domain approach, a comprehensive wraparound evidence-based approach, and it really is a paradigm shift in the care of parents and babies, because over these many systematic reviews and other publications, and then there's about 9 evaluations now that show very positive results. I've applied the lenses of evolutionary biology and of complexity science or dynamic systems science to integrate across these interdisciplinary bodies of research, and then translating that into programs that we deliver to parents, or indeed we offer to health professionals for upskilling. So there's nothing like it internationally, is the truth. This is truly innovative work, and the Possums baby and toddler sleep domain is a very significant part of what we're doing, but just one part, because the other domains all interact with that as well.
I was wondering about baby sleep myths. I know that I'm an NDC accredited practitioner myself, so I know about the baby sleep myths that still really strongly exist in society, even though they're not evidence-based. I'm just wondering, what do you think? Like, why do they still exist so strongly, even though we know they're not evidence-based? What's your opinion on that? Sleep, for example.
Yes.
What have we that children need to be taught how to sleep or to sleep.
Yes.
So how did you find
Well, firstly, I think there was the whole explosion of first wave behaviourism as a psychological movement in the 50s and 60s that was then, if you like, brought into the care of mothers and babies, because in the post-war period, when most births began to happen in the hospital setting, there was a tremendous decline in the capacity to support breastfeeding and a lot of chaos and infant distress. So the first wave behavioural approaches were seen as a kind of scientific way of dealing with high levels of distress by getting routines in place, and it sort of merged with some of the old Nightingale methods within the hospital setting in those years. But here in Australia it was called scientific mothering. And so this then became really socioculturally embedded, that we have to exert control in order to relieve a woman's exhaustion and distress and to manage an infant's inevitable distress. These were the kind of beliefs. So we have to entrain, in the way of first wave behaviourism, we use extinction methods to entrain the infant's biology, only of course that typically doesn't work for most families. But this is certainly a deeply embedded belief system. I'll often tell the story of here in Queensland when I was 14, all the girls had to do mothercraft classes while the boys, lucky things, got to go off and do woodwork and interesting things like that. And of course in the mothercraft classes in the 1970s, we were taught routinized approach to sleep and to feeds was integral to being a good mother, and that you didn't overstimulate the baby's nervous system, that was being a bad mother. And these sort of fundamental beliefs have really not been challenged because there's not been historically a research priority actually on the holistic care of a woman and her baby, or parents and their babies. So it's just now, starting with our first publication in infant sleep, which came out in 2014, and by then I'd already been delivering it for years, but a number of years. But with a colleague, we laid it out as an innovative model, a paradigm shift in the care of infant sleep. This really was the first time. The first wave behavioural approaches were being seriously challenged by a new theoretical frame or theoretical model, which at the same time we'd already translated clinically. So anything subsequently will be derivative, because that basic theoretical framework was laid down in that 2014 paper, building on my own clinical service delivery of the previous years. Yeah.
And what do you think about the fact that parents are often pressured to teach their child to sleep and to start a strict sleep schedule? Because I've noticed there's so much pressure in the society that parents have. So how do you look at that?
It's one of those belief systems that I think in 20 years' time will be completely out of the picture. But it is the belief that if we want to be kindest to a mother and her baby, or parents and their babies, we teach them to quickly get in control of the infant's biology. It's a fundamentally flawed premise. It's not how we can relate to our infant's little body, little biological needs in a way that's responsive and that scaffolds them up developmentally. But it's a belief system that we need to quickly get in control to make life manageable for both the mother and the family and for the baby. So, of course, what happens very often, not always, but very often, it actually makes life so much harder for that family, because unless you've got a very high sleep need baby, for most babies with average to low sleep needs, these kinds of first wave behavioural instructions around, only be awake for such and such a period of time before the baby sleeps, try to get second sleep cycles, 12 hours in the cot overnight or whatever. This is actually a recipe for disruption to the circadian clock and increasingly frequent excessive night waking over time. We've got developmentally normal night waking, where we want everyone back to sleep as quickly as possible. And we know that our breastfeeding women really do get as much sleep overall as parents who are needing to use formula. So we just want everyone back to sleep as quickly as possible. That's developmentally normal night waking. But this excessive night waking that's so prominent in our society is actually very often generated by the first wave behavioural approach, where as health professionals we think to be a good, responsible health professional, I need to have that family put these strategies in place. Parents get the message that to be good parents and to make life easy, I need to be putting these strategies in place. And yet actually the sad reality is that this sort of sociocultural set of beliefs is actually making sleep so much harder for families with babies and toddlers than it needs to be.
So what has your research shown about the importance of early interaction between a parent and a child, and what about limiting the parent and child interaction. So what have you discovered with the early interaction?
Yes, and so this is research that's emerged out of neuroscience and out of the psychological focus on the development of secure attachment styles for our babies and children. So this is much broader research that I've drawn upon in creating the clinical and educational translation of the Possum Sleep Program. And this tells us very clearly that our best developmental outcomes, our best mental health outcomes for our babies and children comes with what we might call responsive care in the first months of that little person's life. We talk about it in the NDC or the Possums programs as just patterns of sensibly responding to the baby to keep that little dial on the sympathetic nervous system as turned down as we possibly can in a sensible way, knowing that we can't always dial the bubby down, knowing that we can't always respond. So that responsive care is so clearly established to be really important for optimal developmental outcome. And actually, despite the adjective of gentle that's now so often put in front of the first wave behavioural sleep programs, is actually paradigmatically contrary to the first wave behavioural approaches, because the concept of entraining infant biology or extinguishing certain infant behaviours, most aren't doing outright cry it out now. They'll be doing, say, what's phrased as controlled comforting, which is a form of graduated extinction. It's still extinction method, and it will still require delaying responses to the baby's cues and not responding in a way that you kind of know in your heart your baby's actually wanting. And so this disrupts, I talk about communication confusion. It really disrupts communication between parents and babies. Parents are doing what they've been told they're meant to do to be responsible parents, which is, delay responses, often sort of gradually extending the period of time that elapses before you respond, or patting the mattress or the baby but not picking the baby up, which you kind of know in your heart is what the baby wants. So this directly disrupts communication between parents and babies and creates, we know from the research, there's growing research to show that the first wave behavioural responses exacerbate parental anxiety around sleep. And I think that's just very clearly because we're setting up this is what you've got to do to be a good parent and to get good outcomes for your baby's sleep, versus a kind of evolutionary hardwired knowledge that I want to be responding to my baby, that my baby's communicating to me and wants me to pick the bubby up and respond.
It's hard for the parents as well.
Very hard for the parents.
They're only doing the best for the family.
Parents are really looking to trusted health professionals to do the absolute best that they can. Definitely. So this is, and of course health professionals are just doing what they're trained to do. So this is a health system problem, and the health system is simply living out a socio-cultural trend from the post-war years that particularly started in the English-speaking world, but has spread. So we're really looking at a paradigm shift in the way we make sense of what's going on, and I think we find parents are just so relieved to find the Possums baby and toddler sleep program, because it's genuinely science-based. We're not just saying we're evidence-based as a marketing tool. We're genuinely evidence-based, we're evaluating what we're doing.
Yes.
And we get really good results. Yeah.
That's great. That's great. And I have a few more questions. We just go quickly through them. But
yes.
In Finland, there's still this myth that all babies and children need to sleep from 7 p.m. to 7 a.m.
Yes.
And parents are quite anxious about it as well, because they only want the best for the babies. Like, they want them to sleep well. They kind of worrying about if the babies getting enough sleep or not.
Yes.
So what's your opinion about this 7 to 7 sleep, or about getting babies rather a bit later than earlier to bed? And
yes.
you probably have the same in Australia.
Yes, it is. It is. But of course, we know from the research, from big studies now, that infant sleep. Yes, that's right, actually, in the last couple of years. Yes, I cite that because it was really a good one and a big one. And it shows, doesn't it? You would know this, Tiia, but it shows that infant sleep needs are biologically highly variable. So we can have, depending on the age, but even our newborns, we can have a newborn who needs barely 9 hours total in a 24-hour period. You know, maybe half an hour total during the day, 10 minutes here, 5 minutes there. Normal developmental outcomes, normal cognitive development may always be a low sleep need child. That's one end of the bell curve of normal. And then we can have a newborn who needs 18 hours total in a 24-hour period, twice as much. So you'll see in the possum sleep program, as you know in your own practice, we don't ever give advice around how much sleep a bubby needs, but we're very interested to support parents to keep the biological sleep regulators operating in a way that's healthy and really well aligned with the parents, with the adult sleep needs at night.
And what do you find, like, what would you give as a tip for anxious parents that are worrying about, is my baby getting enough of sleep? What would be your best advice, if this is how you know? Do you have anything you can advise?
So this is where we think about that dial on the sympathetic nervous system. And as you know, Tiia, because you're NDC accredited, we talk about the 2 tools to keep our little ones sensibly dialed down as we can. So one is milk, offered frequently and flexibly, and of course with the older bubbies, solids are coming in there, but you know, and things may change, but in those early months we're thinking milk, frequent flexible offers, and rich and changing sensory nourishment, sensory motor stimulation. And again, there's a lot of misconceptions out there about our babies' sensory motor needs. And out of the first wave behavioural approaches, families are often told not to let the little ones get overstimulated. But you see, I always say that's so last century, because in fact, the research tells us that rich and changing sensory motor input right across the baby's senses, including proprioceptive input, vestibular input, all of this optimises developmental outcomes for our infants. So we want rich and changing sensory motor input, and babies will cry if they're in a low sensory environment, like the interior of our homes. And so we want lovely, rich, changing sensory motor nourishment, which typically occurs in an environment outside the boring old interior of our homes, you know, getting social and being out and about. And frequent flexible milk, if we're looking at these little ones, you know, basically a satiated baby. And then we can actually trust sleep to look after itself. That sleep is hardwired biological drive, that we're not teaching our children to sleep. We're simply removing obstacles like being very dialed up that would get in the way of easy, healthy infant sleep. Sleep will happen if we're having days that are rich in sensory adventure, typically outside the home, and the little one's satiated.
So basically keeping these 2 dials down, then we can trust the baby will take the
Absolutely.
sleep.
And then some will be very high sleep need, many will be middle to low sleep need, many more than we expect in our society. We're typically expecting our infants to have more sleep than they actually need. If we look internationally, babies are often going to sleep much closer to parent bedtime in the first 12 months of life than this instruction of 7 to 7 would have you believe. And of course, you can see what a recipe for nighttime distress it is. If we do have a low sleep need bubby, let's say 9 hours total in a 24-hour period, so maybe 8.5 hours at night, let's say, we're putting that little one down at 7 p.m. Well, at 2 a.m, 3 a.m, this little one will be waking every hour, every half an hour, not settling back to sleep at all, because that bubby's metabolism will be ready to start the day. So there's a whole range of strategies, again, as you know, that our clinicians will put in place if families are dealing with excessive night waking, this kind of disruption. But in fact, if we take off the sleep lens, focus on a rich, full and satisfying life, ideally outside the home for that primary carer, with the little one basically just following along, fitting in, we actually don't have to worry about sleep durations. We don't need to be counting it. 5-minute nap just takes the edge off that sleep pressure, on with the day. It's a very different way of thinking about sleep.
Definitely.
And was really, in when we first started to bring it out, we called it a baby sleep revolution, really. Yeah. Well, that was what we called it.
It just definitely is.
Yeah.
And then about your research and research that you've read, like how can we best improve like parents' well-being? How can it be improved and supported? What you found are the best strategies that we can put in place for tired parents? I know it's a long question, but just shortly.
Yes, no, absolutely. Well, I think it's important to remember that our approach to making sleep easy without stress sits alongside really very sophisticated clinical interventions for breastfeeding problems, which are often not appropriately identified and managed in our society. Actually, it's a painful thing to say. So we have really very, as you've experienced, a real focus on better understanding issues around positional instability, fussiness with breastfeeding. So we know that breastfeeding problems increase the risk of postnatal depression. We know that sleep problems increase the risk of postnatal depression. We know that cry-fuss problems increase the risk of postnatal depression. But we can't deal with cry-fuss problems, I would propose, unless we're putting in place a holistic, multi-domain approach, which we call the NDC or Possum's 5-domain approach, that deals with sleep, that deals with the breastfeeding, that deals with a baby's sensory motor needs, as well as the bub's gut and what's happening with mood for the parents. So I've been saying for many years that although when we're wanting to protect a mother or indeed parents against postnatal anxiety and depression, we're certainly concerned about a history of depression and anxiety, we're certainly wanting to use a range of psychological and sometimes pharmaceutical support for those families, but a big focus on psychological support. But actually, we can't seriously address the high rates of postnatal anxiety and depression until we're dealing with widespread, unidentified, unmanaged breastfeeding problems and the widespread disruptive approaches to infant sleep that have been normalised in our society, and an integrated, holistic approach to the baby who's crying and fussing. Again, this is a paradigm shift in NDC. We're saying that we can't silo off parental exhaustion or indeed anxiety and depression from what's happening in these domains of infant care, where actually we're stuck very often in some very outdated, if ubiquitous, approaches. We do need a paradigm shift here that occurs with the sleep, but also occurs with the breastfeeding and with the approach to cry-fuss problems.
Multi-dimensional.
Indeed.
Because we get asked a lot about baby, how often, what's normal night waking, and we spoke earlier about the night waking. It's really hard for the parents, but based on the newest research, I know you're big on research, so what would you say is the normal amount of night wakings for a baby, say infant?
Well, when we look at the big cohort studies, such as the one that came out from Finland, really we're looking at every couple of hours at night. Waking is normal for infants right through into toddlerhood, actually. So it's not to say that every baby will wake every couple of hours, but many will, and that's absolutely normal. We just want everyone back to sleep very quickly. We don't want big blocks of wake time during the night, and we don't want patterns of excessive night waking every hour, 45 minutes is a pattern regularly throughout the week. So every couple of hours, don't look at the clock, but every couple of hours and back to sleep pretty quickly. That would be developmentally normal right throughout the first year of life, well into toddlerhood.
And then the final question, I have read, I'm a big fan of you and your program, and the breastfeeding, got a lot of research in Gestalt breastfeeding and a lot of knowledge about how feeding and sleep are related. So can you just talk quickly about how the feeding and sleep are related and how there's this many people find it really hard with the baby waking often, which is totally understandable, but quite often people think that it's because of the breastfeeding, that the breastfeeding is causing the excessive waking, even though we know that's not exactly true.
Yes,
so
that's right.
Can you just shortly describe what's your opinion or how you find it, and what's the latest research on this matter?
Yeah. Well, so in the NDC frame, you see, we would be saying the excessive night waking. We do want to exclude a viral infection, for instance, or particularly in those early weeks, a hungry baby who's not thriving. But once we're through that sort of very early establishment of breastfeeding, and there's generally acceptable weight gain, the excessive night waking comes about due to disruption of the circadian clock in a society where first wave behavioural strategies are really disrupting good alignment of the circadian clock in the baby with the parent's circadian clock. So it's true that little one will have learned, and we don't talk about this as a bad habit, it's a gift, that little one has learned that the loveliest way to get back to sleep in the night is to come to the mother's breast.
Or then with the bottle and close to the
bottle. Yeah, absolutely, Tiia. That's it. That's right. But what we need to deal with is the underlying disruption to the circadian clock. That little one isn't waking because they're being offered the breast or indeed the bottle in a way that's responsive, frequent and flexible. Now, with any talk of our bottle-fed bubs, our formula-fed bubs, the frequent and flexible use of the bottle, which we call paced bottle feeding. And you're probably aware Renee's got that lovely video on our website about that.
I can link that too.
Yes, thanks. So the paced bottle feeding has a role in those first months of life, but with our formula-fed bubs as they're approaching the 6-month mark, we do just need to be mindful that the volumes of formula are within recommended ranges. But that aside, of course, in the early months with the bottle and definitely with the breastfeeding, that frequent flexible access to the breast dials babies down, but is not causing excessive night waking. That's due to disruption to the biological sleep regulators, and we can then deal with that. In fact,
different ways, not necessarily to stop breastfeeding at night.
Not at all. No, we would want to support a woman to breastfeed in the night for as long as she wants to do that. That's right. It's for those who are going forward with the breastfeeding in the night. It's such a lovely way just to dial everyone down quickly and get back to sleep.
Definitely.
We have one of our evaluations of the Possums baby and toddler sleep program was done by a team in Turkey. Professor Perrin Boran and her team evaluated a possums-based intervention that they were using in a randomised controlled trial, and showed that the possums work very substantially protected breastfeeding outcomes.
Wonderful. Wonderful. Thank you so much for doing this interview.
Well,
with
it's
us.
my pleasure. It's been wonderful to have you visit. And thank you so much for your support, Tiia.
Thank you. Thank you.
Yeah.